Rifcord podcast.
The Canadian healthcare system is really the envy of many countries around the world, right? We have an amazing healthcare system, and lots of places where we can improve. And I think one of the things that's great about working in healthcare in Canada and in Ontario is a willingness to keep thinking about how do we do this better and differently. And there are lots of people who have had negative experiences from whom we can learn. A couple of themes that I see happening in the healthcare system today is the democratization of health services and information. And by that I mean a huge power shift. And this is very tech driven, but also very consumer driven of, I would like to organize my own healthcare. Thank you very much. Oh, it's going to take you 10 years to build out a system where you can coordinate my health records between organizations? No problem. I'll put them on my watch. There is a very, in our world, we have democratized all kinds of different industries. And so giving people who use the services more power to deliver the service themselves, choose their service providers, have the information, carry it around with them, organize it, think through and participate. And so we're seeing a lot of friction from time to time in the healthcare system now in the engagement of patients or consumers, caregivers, families who want, who have this expectation from these other industries and come in contact with the healthcare system, which sometimes feels like it's ready and sometimes absolutely not. And so, this is a time of collision of these ideas. And a lot of times technology is ahead of the policy, the procedures, the organizational culture. And so we do see quite a lot of friction in that area right now. Our government in Ontario is moving towards funding models that are different from what we've had before. So when I mean throwing things up in the air, we're seeing in different geographic regions and for different kinds of patient populations, funding that will be more like Krista was talking about, a continuum of service, recognizing that many people stay in their communities or in the surrounding areas, and they want to have coordinated care for the services that they receive, and it doesn't really make sense that they have to repeat themselves. It's like, but I already did that test, but I've already said those words, I've already explained this. And just as you said, we've had these amazing technologies that we can turn around on a dime, do that 14-hour surgery, and yet we still use fax machines to communicate important information, and important information isn't always readily available. So, our government is trying to change up the funding system so that there are regional teams, Ontario health teams that span, a person's life. So it's different, and nobody knows what the outcome is going to be. Either it will be very similar to what we have now, or it could be very different, having truly coordinated care and systems around that care.
You're listening to the Rifcord podcast.